much, Len. And our next speaker is Dr. Sonia Adesara, who I actually thought I must have met before, but we spent a lot of time on Zooms together during the pandemic. I'm not sure if anybody else has had that, where you've been on Zooms with someone and you think, oh, I know you, but I haven't. So it's nice to meet you.
Sonia. I don't even met in real life.
Yeah, and so Sonia's an NHS doctor who is from Keep Our NHS Public. Sonia.
Yeah, thank you, Belle. Yes, my name's Sonia, I'm an NHS doctor, I'm a health campaigner, and I'm a trade unionist. And I say all those things because they are interconnected. And when you have health workers who are being treated poorly, who are being paid poorly, who are being forced to work in poor conditions, then it's the health and the care of our patients that is compromised. Now within the NHS itself, outsourcing is far-reaching. And outsourcing didn't begin under this government, but it has increased significantly over the past few years, which is really worrying. And in April, there was a Health and Social Care Act that was passed in this place. And I know health legislation can be quite dull for some people, but I think there's a really important point about that. In that legislation, that it said that it allowed private providers who were providing NHS services to sit on the boards, on these newly created integrated care boards. So what does that mean? It means that alongside the rising role of the private sector in the NHS, through this bill we are having private providers being put into positions of potentially governance, of influence and of power within local health systems, which I think is really worrying and is happening, I think, with quite minimum public scrutiny. So why does outsourcing happening? So when an NHS service is put out to the market, it's put out by law, it needs to be put out to the market. And we know in previous years under this Tory government and under previous Tory governments that NHS funding has been really, really squeezed. So CCGs are desperate to try and find ways to save money. And what happens is a private provider will come along and say, hey, we can provide a service for cheaper. So that's what happens, and they give the contract to the private provider. But how do they provide it cheaper? And most of the time they do this by either cutting quality, cutting staff, cutting wages. And it's a combination of that leads to care being compromised. And it can, that harm that's being done to patients can be quite difficult to quantify, but we do have research. So we know that there is an associated rise in MRSA when you're outsourcing cleaning staff. We know that nutrition has gone down when you're having hospitals outsourcing food. And actually, I think most people, when they work in the NHS, they can tell you examples of where they've seen that care being compromised. So just before this event, I had an email from one of my colleagues in Unite, and he is a haematologist, a consultant haematologist, and he told me in the area that he works, they outsource the pathology services. And then this private company was losing samples, there was delays in processing, they put all their workers on draconian contracts, so people left and they had staffing shortages, and what's the result? We had delays in cancer diagnosis, you had patients being turned up to chemotherapy centres and they had to be turned away because they didn't have their results in time. So it is real harm that's happening as a result of outsourcing. And I always used to work in a London hospital where there was a lot of outsourcing happening. And there was one, our patient transport service was just so bad. There was repeated bad things happening to patients. And in the transport service, it's really important. They're taking home our elderly and our most vulnerable patients. And I remember asking one of the drivers, saying, why is this service so bad? And he told me he used to work when it was insourced, but he said the service was outsourced to a parcel delivery company. And he said, and I think this is his exact words, his exact phrase was, the company treats patients like parcels. And I think that really epitomises the problem of when you commodify healthcare. And with private providers, their primary priority, as Francis said, is to squeeze as much profit as they can out of the system. And the result of that is detriment to workers and it's detriment to patients. Now, I guess to finish, I think it's been quite negative so far, but I think, as Len has said, this can be positive as well, and there has been wins within the movement. And I think, I guess my experience is that actually health workers really underestimate or actually don't appreciate their collective power. And I really think, and I have so much respect to everyone on the panel that's spoken, because what needs to be happening right now is that we need that mass drive of unionisation of NHS workers. And this campaign against outsourcing, I think it must be led by outsourced workers like Mimi, who are just, I commend you, you're so brave, you're so brilliant at everything you're doing. But we have to build that power base behind them, and we do that by unionising all NHS workers who are organising and supporting people behind them with those shared ideals. And finally, at the forefront of this, as Mimi said, this is about equality, and it's about respect, really. It's about respect for outsourced workers. But this is actually, the importance of this is much greater than that. And this is about the nature of work in this country, and how such low pay has become normalised in this country, that you have people working at Croydon Hospital who can't afford formula milk for their children. And this is about, as Mimi said, this is about racial justice, and it's about equality. And within the NHS, and actually, wider society as well, but we see this, it's quite stark within the NHS, that it is predominantly racialised minorities, migrant workers and working class workers who are disproportionately on these low paid, insecure and precarious work. And thirdly, this is about our public services, not just the NHS, but all public services that are being undermined and being degraded by this continued drive towards outsourcing. So I'll finish there, but I think we have to unleash that collective power that we have within the NHS workers, and we at He Ventures Public, we're completely behind you in all these battles, and I think NHS unionisation has power and has such power for change in this country, and I think there is such potential here for us to be unleashed. Thank you.
Thanks, Sonia. We're going to go to our next speaker, who's Loretta